Mental Health Month, and this topic is always an important one, but right now, incredibly crucial for everyone, including those on the front lines as well of the pandemic. So you know who you are not alone in this as well. And Dr. Chris Colbert from the Emergency Medicine Residency Program at UIC joins us now live to talk about this. So doctor, thanks so much for being part of our morning. We appreciate your time.
Thank you for having me. Good morning.
Good morning. So one of the things, Dr. Colbert, that I often say on this shift with this crew here in the studio is, okay, guys, yes, this is stressful, but it's not the ER. We're not trying to save anyone's lives. And then this morning I see you and I'm like, that is your job. That's what you're doing, especially during the pandemic. First of all, thank you. But second of all, how are you dealing with that pressure and that stress? Because you're literally doing just that.
Well, first of all, thank you. There is a significant increased amount of stress within the emergency room, specifically under the context of COVID. There is an emotional toll that is taken by all healthcare providers. And in light of that emotional toll, there's a part of conversation and structural support that's extremely important for all healthcare providers to ensure that we work in a both safe and mentally safe and healthy environment.
You know, doctor, I think a lot of us look at all of you definitely as heroes as we go through this pandemic, but there's a lot of pressure there because of your job, because of what you're doing, the conditions, the long hours that you are working. How important is it to just be vulnerable sometimes and say, you know what, I need help? And how about you personally? Have you felt like you've been in that position?
And that is a great question. And in fact, I would say that most healthcare providers in some way, shape, or form, just because we're all human, have felt in some way, shape, or form that that guilt of not having the ability to provide the definitive management for that patient at that time, because the COVID, in fact, is a very dynamic process. Unfortunately, we don't have the luxury to say, hey, you know what, this is an acute appendicitis. We can call a surgeon. The surgeon can come down, and after surgery, you'll be okay. But this is a very new and very dynamic process of a virus. So when we see these patients, it does take an emotional toll. For me specifically, I spend a lot of time with family, walking our new puppy, listening to music, reading something other than medicine, and coupled with that, just working out at home with a little bit of workout environment.
How do you compartmentalize? Because I know sometimes a day goes by when I'm doing a really tough story or it's mentally difficult or you're dealing with death in some cases, and I understand that. In your case, you're dealing with it. How do you put that? I hear what you're saying about taking your time to do what you need to do to stay healthy. How do you sometimes not let those thoughts creep up on you in the middle of the night or when you're sitting down for dinner, those difficult times?
Well, that's a great question as well. And a very healthy aspect of being